symptoms. An often overlooked one can be severe pain when breastfeeding. And I'm glad to say breast surgeon Associate Professor Sanjay Warrier joins us now to talk about the issue. Professor, when should women start worrying about pain when breastfeeding?
And thanks for having me, Angela. Like you said, it's great that we're talking about this at a time when it's Breast Cancer Awareness Month. I think ultimately the reason we're talking about it is because we do see breast cancers in pregnancy and postpartum as well. And generally the assumptions are when you have a lump, is that it's associated with breastfeeding or issues with breastfeeding. It's commonly, the commonest reasons are benign or non-cancerous, but ultimately if there's a persistent lump or ongoing redness that's resistant to antibiotics, it definitely is a reason to be concerned.
So how quickly should a woman who senses these symptoms or has a pain that just continues abnormally during breastfeeding seek a second opinion and check out whether it could in fact be breast cancer?
Yeah, again, just put in context that commonly it won't be breast cancer, but if you do have a lump that's not resolving, I would recommend seeing a specialist, whether it's through your lactational consultant, GP, or breast specialist. It's important to get it checked out. There's a bunch of benign reasons for having a lump. That includes engorgement from feeding issues potentially. It could also be from a blocked duct, and secondary from that sometimes infection, which we call a breast abscess. And they're commoner reasons, but if there's a lump that's persistent or getting bigger, it could be painful or painless. It's definitely worth getting it checked out, and then we would appropriately image.
Is it harder to detect breast cancer in women who are breastfeeding?
That really is an issue. Like, the first thing is we're not expecting it in breastfeeding, which is the first thing. But when we do imaging, often the breasts are denser, and with that, it makes contrast imaging or mammograms harder to do. But we can still do ultrasounds, and with that, we'd be looking to see if there's a solid component. And if there is a solid component, we would generally then consider potentially biopsying the lesion.
And as we kick off Breast Cancer Awareness Month, what's your message to all women about what we should all be doing?
Yeah, my message is being on the coalface. We see women with breast cancer, and it really does make us relax when we're seeing patients when they're diagnosed with an early breast cancer. It really does change the outcomes for those patients. So, and often women are looking after their families and they're very busy, but it really is a time to get checked, get up to date with your screening. And if you're noticing any lumps and you've put it off till now, please go and see a specialist. We also have a great screening program that's appropriate for free screening for patients as well. So I'd recommend in October just getting your checks done, even if you don't have symptoms. And for us on the other end, we then are potentially seeing cancers before they hit the lymph nodes or go to other parts of the body, which allow for less treatments for the patients.
Professor Sanjay Warrier, thank you very much for your time.
Thanks, Angela. I really appreciate it.